Good morning, gentlemen. Dr. James Whittaker here. And today we're going to have a conversation that most men are too embarrassed to ask their doctors about. Yet it's something that comes up constantly in my practice, particularly among men over 50 who are navigating intimacy in new relationships or rekindling passion in long-term partnerships. This is about oral intimacy, specifically questions around safety, hygiene, and how to approach this aspect of your intimate life with confidence and knowledge rather than anxiety or confusion. Now, before you click away thinking this topic is too uncomfortable or not relevant to you, let me tell you that just last week, three different patients asked me variations of the same question during their appointments. These were men in their 60s and 70s, some in marriages of decades, some in new relationships after divorce or widowhood, all wondering about the safety and proper approach to oral intimacy. If you're thinking about it, you're not alone, and you deserve accurate medical information, not internet rumors or locker room mythology. Before we dive into the specifics, if you're new to this channel, welcome. I'm a board-certified physician who spent over 2 decades in men's health, and I create these videos to give you honest, evidence-based information about topics that are often avoided in traditional medical settings. If you find value in what we discussed today, please hit that subscribe button and turn on notifications because we tackle the questions most men are too uncomfortable to ask their doctors face to face. Now let's address this topic with the medical clarity and straightforward honesty it deserves. The core question I hear most often is this: is it safe to engage in oral intimacy with my partner? What about swallowing vaginal fluids? What should normal taste and odor be like? And when should I be concerned? These are legitimate medical questions that deserve professional answers, not guesswork or embarrassed silence. By the end of this discussion, my goal is for you to feel informed, confident, and able to approach this aspect of intimacy with both safety awareness and genuine comfort. Let me know in the comments below what country you're watching from. I'm always interested to see how men from different cultures approach these conversations, and whether this topic is discussed openly or remains taboo in your area. Your comments help me understand what information you need most. Now let's start with the biological basics because understanding what's actually happening in your partner's body removes a lot of the mystery and concern. Vaginal lubrication is not just moisture, it's a sophisticated biological response that serves multiple important functions. It's a carefully coordinated blend of secretions designed to prepare the body for intimate contact. These fluids reduce friction during intercourse, protecting delicate tissue from microscopic injuries. They maintain optimal vaginal pH, which is slightly acidic to prevent infections. And they support the local immune system by containing beneficial bacteria and antimicrobial compounds. Even in women past reproductive years, vaginal fluids continue to be produced and serve these protective functions, though the amount and consistency may change with hormonal shifts. There are three primary sources of vaginal lubrication that you should understand. First, the Bartholin's glands, located near the vaginal opening, secrete a lubricating fluid during the early stages of sexual arousal. This clear, slippery fluid is essentially nature's own lubricant, designed specifically for comfortable, intimate contact. Second, the Skene's glands, sometimes called the female prostate, are situated near the urethra. These become more active during deeper stages of arousal and may be involved in female ejaculation in some women, though this varies considerably. Third, the cervix produces its own mucus that changes throughout the menstrual cycle. Even in postmenopausal women, some cervical secretion continues, helping maintain moisture and microbial balance. Together, these sources create the natural vaginal fluid that typically appears clear to slightly milky and has a mild, slightly musky scent. This combination is completely normal and healthy. Understanding this removes the mystery and helps you recognize what's normal versus what might indicate a problem requiring attention. Now let's address something that men ask about constantly but rarely get honest answers to. What affects the taste and smell of vaginal fluids, and what's considered normal? This is where a lot of anxiety and misinformation exists, so I want to give you the straight medical facts. Vaginal taste and scent are influenced by numerous factors including hormones, hydration status, diet, stress levels, medications, smoking, and where a woman is in her menstrual cycle. All of these create natural variations that are completely normal, not problems that need fixing. Let me give you some specific examples. Hydration plays a significant role. When your partner is well hydrated and eating a balanced diet rich in fruits and vegetables, her natural secretions tend to have a milder, sometimes slightly sweeter taste and scent. Certain foods, particularly pineapple, citrus fruits, and berries, may contribute to a subtly more pleasant taste, though the effect is modest. On the other hand, foods high in sulfur compounds like garlic, onions, asparagus, and cruciferous vegetables can create a stronger, muskier scent. Coffee and alcohol can increase acidity and intensity of both taste and smell. Hormonal fluctuations create predictable patterns that are worth understanding. Around ovulation, when estrogen is highest, vaginal fluids tend to be more abundant, clear, and relatively neutral in taste. During menstruation, there may be a faint metallic note due to trace amounts of blood, which is completely normal. After menopause, decreased estrogen often results in less lubrication that may be slightly more acidic. All of these variations are normal biological responses, not defects or problems. They're simply reflections of your partner's physiology at that particular time. However, and this is important, sometimes changes in odor or taste can signal a treatable condition that needs attention. A suddenly very strong or unpleasant fishy odor, especially if accompanied by itching, burning, or a change in discharge color or consistency, can indicate common conditions like bacterial vaginosis or yeast infections. These are not reflections of poor hygiene or personal failing. They're simply biological imbalances that respond very well to treatment once properly diagnosed. If you or your partner notice these changes, the appropriate response is a visit to a healthcare provider, not shame or avoidance. Let me share a story from my practice that illustrates this point. A patient in his late 50s, recently divorced and dating again after 25 years of marriage, came to see me clearly uncomfortable. He'd been intimate with a new partner and noticed an unfamiliar strong odor during oral intimacy. He was worried it might mean something was wrong with him or that he'd been exposed to an infection. We talked through what he'd experienced, and I explained that what he'd likely encountered was bacterial vaginosis, an extremely common and easily treatable condition caused by an overgrowth of normal vaginal bacteria. It's not a sexually transmitted infection, though it can be triggered by sexual activity. I encouraged him to have an open, compassionate conversation with his partner, suggesting she see her doctor. She did receive simple antibiotic treatment, and the issue resolved completely within days. What could have become a source of anxiety and distance instead became an opportunity for communication and deeper trust in their relationship. Now let's get to the central question that brings most men to this topic. Is it medically safe to perform oral intimacy on my partner? And specifically, is it safe to swallow vaginal fluids? The evidence-based medical answer is yes. In most circumstances, it is safe for healthy individuals in mutually monogamous, STI-free relationships. Let me explain why. Vaginal secretions are composed primarily of water, along with amino acids, minerals, enzymes, beneficial lactobacilli bacteria, small amounts of glucose, and lactic acid. These are the same substances that maintain a healthy vaginal environment. They are not toxic, not harmful, and not inherently dirty or dangerous. From a microbial standpoint, oral contact with vaginal fluids in a healthy, infection-free partner actually carries fewer transmission risks than activities most people engage in without a second thought, like deep kissing or sharing drinks and utensils. The key phrase here is infection-free partner, because that's where the important caveats come in. Here's what you absolutely must understand. While vaginal fluids themselves are not dangerous, they can carry sexually transmitted infections if your partner has one, just as semen or blood can. Common STIs, including chlamydia, gonorrhea, herpes simplex virus, trichomoniasis, HPV, and yes, even HIV, though rarely, can be present in genital secretions even when there are no visible symptoms. This is critical to understand because many STIs are asymptomatic, meaning your partner could have an infection without knowing it and without any obvious signs. This isn't about trust or character, it's simply medical reality. During oral intimacy, these infections can be transmitted to your mouth and throat. The risk varies depending on the specific infection and circumstances, but it's not zero. Particular caution is warranted if you have any breaks in the skin or mucous membranes of your mouth. Open sores, ulcers, cuts, bleeding gums, or recent dental work all create potential entry points for pathogens and increased transmission risk. If you've had dental cleaning, extractions, or any oral surgery in the previous few days, it's medically prudent to wait until your mouth has fully healed before engaging in oral intimacy. So what do we do with this information? How do we balance the desire for intimate connection with appropriate health precautions? The answer is simple. We combine passion with wisdom. True intimacy isn't just physical connection, it's emotional safety, honest communication, and mutual respect for each other's well-being. And that foundation starts with open conversations about sexual health. Let me walk you through the practical steps that protect both you and your partner while maintaining the intimacy and trust that make relationships fulfilling. First and most importantly, know your STI status and your partner's status. This isn't about mistrust or accusations. It's about mutual care and responsibility, exactly like monitoring blood pressure, cholesterol, or any other health parameter. If you're in a new relationship, or if either you or your partner has had other sexual partners since your last testing, get screened. Modern STI testing is simple, relatively inexpensive, and widely available. Most tests require just a urine sample or quick blood draw, and results are typically available within days. For sexually active adults, particularly those over 50 who may be dating after divorce or widowhood, I recommend STI screening at the beginning of any new sexual relationship and then annually if you remain sexually active. Yes, even if you're in what you believe is a monogamous relationship. This isn't about suspicion, it's about recognizing that some infections can remain dormant for years and that honest mistakes and miscommunications happen. Regular screening removes doubt and provides peace of mind. Second, have the STI conversation early in your relationship before intimacy begins if possible. I know this feels awkward, especially for men who came of age in an era when these conversations simply didn't happen. But I can tell you from decades of practice that couples who can discuss sexual health openly almost always report stronger, more trusting relationships overall. The conversation doesn't have to be clinical or uncomfortable. A simple approach works well. I care about both of us staying healthy, and I think it makes sense for us both to get tested before we become more intimate. Would you be comfortable doing that together? Most mature partners will respect and appreciate this approach. Third, consider using barriers during oral intimacy, particularly in the early stages of a relationship, before you both have clear STI test results. For oral intimacy with a female partner, this means using a dental dam, which is a thin latex or polyurethane sheet that creates a barrier between your mouth and her genitals. I'll be honest, dental dams are not widely used and many people find them awkward. However, they do significantly reduce STI transmission risk during oral sex. They're available online and at many pharmacies, and they're much more affordable than dealing with an STI infection. Alternatively, you can create a makeshift barrier by cutting a condom lengthwise to create a flat sheet. Is this the most spontaneous, romantic approach? No. But in a new relationship where STI status is unknown, it's the medically prudent choice. Once both partners have been tested, results are negative, and you're in a mutually monogamous relationship, the need for barriers during oral intimacy is eliminated. Let me share another patient's story that illustrates why these precautions matter. A man in his early 60s came to see me after developing a persistent sore throat that wasn't responding to standard treatment. After several weeks and multiple rounds of antibiotics that didn't help, we did a throat culture and discovered he had gonorrhea of the throat, contracted through oral intimacy with a new partner. Neither he nor his partner had any genital symptoms, so they'd had no idea an infection was present. Treatment was straightforward once we identified the problem, but he'd suffered weeks of discomfort and required stronger antibiotics than would have been necessary with earlier detection. More significantly, the discovery required an uncomfortable conversation with his partner about STI testing and treatment. The situation could have been entirely avoided with testing before intimacy began. He told me later that the experience, while difficult, ultimately strengthened their relationship because it forced honest communication that carried over into other areas of their partnership. Now, assuming you're in a healthy relationship with clear STI status, let's talk about how to approach oral intimacy in a way that's pleasurable, comfortable, and emotionally connecting for both partners. This is where the medical information transitions into relationship advice, but it's advice grounded in understanding physiology and psychology. First, understand that for many women, particularly as they age, oral stimulation can be easier to enjoy than penetrative sex. Changes in vaginal tissue elasticity, lubrication, and sensitivity that occur with aging can make intercourse less comfortable, while oral stimulation remains pleasurable and doesn't cause the same physical challenges. Knowing this helps you understand that becoming skilled and comfortable with oral intimacy can significantly enhance your partner's sexual satisfaction and your intimate connection overall. Second, communication during intimacy is essential. What feels good, what pressure is right, what pace works. All of these vary from woman to woman and even for the same woman at different times. The only way to know is to ask and to pay attention to verbal and nonverbal feedback. Third, and this is something many men don't fully appreciate, a woman's comfort with oral intimacy is heavily influenced by her sense of being accepted and not judged. If she senses any hesitation, reluctance, or negative reaction to her natural scent, taste, or body, it creates self-consciousness that directly interferes with arousal and pleasure. Conversely, when she feels completely accepted and desired, exactly as she is, it creates psychological safety that dramatically enhances her ability to relax and experience pleasure. This is where the medical information I shared earlier becomes practically important. When you understand that natural variations in taste, scent, and appearance are normal biology, not defects, you can approach intimacy with genuine comfort rather than hidden reluctance. That authentic comfort translates into acceptance that your partner will absolutely feel. Let me be very direct about something. If you encounter a natural scent or taste during intimacy, your response matters enormously. Don't recoil, don't make faces, don't joke or make comments that could be interpreted as criticism. If something seems unusually strong or different, address it later with compassion and concern, not in the moment. A simple approach might be suggesting a shared shower before intimacy, which can be intimate and playful rather than critical. Or if you genuinely think there might be a health issue, you might say something like, I noticed something different, and I'm wondering if you might want to check with your doctor just to make sure everything's okay. I care about your health. This approach expresses concern for her well-being, not disgust or rejection. For many women, particularly those in midlife and beyond who may already feel self-conscious about aging bodies, acceptance during intimate moments has profound emotional impact. Research in sexual psychology consistently shows that a woman's ability to experience arousal and orgasm is heavily dependent on feeling psychologically safe and accepted. When a woman feels that her partner genuinely desires and accepts all of her, including aspects she might feel vulnerable about, it creates conditions for deeper intimacy and more satisfying sexual experiences for both partners. This isn't just emotional speculation. It's supported by neuroscience research showing that emotional safety and acceptance activate neural pathways associated with arousal and pleasure. The practical implication is this. Your comfort with and acceptance of your partner's natural body during oral intimacy can significantly enhance not just that specific activity, but your entire intimate connection. It's a powerful form of nonverbal communication that says, I accept all of you without reservation. That message can be profoundly healing, particularly for women who've internalized shame or insecurity about their bodies. Now let me address a question that men ask me frequently. What if I'm just not comfortable with oral intimacy? What if the idea makes me uncomfortable regardless of safety concerns? This is a legitimate personal boundary that deserves respect, and I want to address it directly. Sexual intimacy should never involve activities that genuinely make you uncomfortable. Healthy sexual relationships are built on mutual desire and enthusiasm, not on one partner simply enduring something to please the other. If oral intimacy isn't something you're comfortable with, that's okay, but it deserves honest communication rather than avoidance or excuses. Many women highly value oral stimulation and may feel disappointed or rejected if it's not part of your intimate repertoire, so this is worth discussing openly. Sometimes discomfort with oral intimacy is based on misinformation, unfounded concerns about hygiene or safety, or cultural messages about women's bodies being dirty or shameful. If any of these resonate with you, I'd encourage you to examine those beliefs and consider whether they're based on facts or on inherited shame. The medical information I've shared today should address most safety and hygiene concerns. If you're still uncomfortable after understanding the facts, then it's a personal preference that you should communicate honestly to your partner. A healthy relationship can accommodate different preferences, but only when they're communicated clearly and respectfully. Before we wrap up, let me summarize the key points you should take away from this discussion. Vaginal fluids are a normal, healthy part of female physiology, composed of substances that maintain vaginal health. They are not dirty, toxic, or inherently dangerous. Taste and scent vary based on multiple factors, including diet, hydration, hormones, and menstrual cycle timing. These variations are normal, not defects. Engaging in oral intimacy and swallowing vaginal fluids is medically safe in mutually monogamous, STI-free relationships. However, STI transmission is possible through oral genital contact, so knowing your status and your partner's status is essential. STI screening should be a routine part of sexual health, particularly when beginning new relationships, and should be approached as mutual care, not suspicion. Barriers like dental dams can reduce risk during oral intimacy in new relationships before STI status is confirmed. Acceptance and enthusiasm during intimate moments, rather than reluctance or disgust, significantly enhance your partner's comfort and pleasure. Open communication about sexual health and preferences strengthens relationships rather than creating awkwardness. And most importantly, healthy intimate relationships in your 50s, 60s, 70s, and beyond are not only possible, they can be some of the most satisfying of your life when built on honest communication, mutual respect, and accurate health information. I want to hear from you in the comments. What questions about intimacy and sexual health do you wish doctors would address more openly? What topics cause you concern or confusion? Your questions help me create content that serves you better. And remember, you can comment anonymously if you prefer. If you found this information valuable and appreciate the straightforward, judgment-free approach, please hit that like button so more men can find this content. Subscribe to the channel and turn on notifications because next week, I'm addressing another question that comes up constantly in my practice: how to maintain sexual function and satisfaction as you age, including what actually works and what's just marketing hype. That's a video you definitely don't want to miss. Finally, check out my playlist on men's sexual health. There are several videos there covering erectile function, testosterone, prostate health, and maintaining intimacy in long-term relationships, all approached with the same evidence-based, shame-free perspective. As always, the information in this video is for educational purposes only and should not replace individualized medical advice from your own healthcare provider. Every person's situation is unique, and decisions about sexual health should be made in consultation with a doctor who knows your complete medical history. Thank you for watching. Thank you for trusting me with these sensitive topics, and I'll see you in the next video where we continue exploring how to maintain vitality, health, and satisfying intimate connections throughout your life. Remember, aging doesn't mean the end of passion or intimacy. With the right information, open communication, and mutual respect, your intimate life can continue to be a source of joy, connection, and health for decades to come. Take care.